Good morning. This is my evidence of human body care, and I'm going to explain Model 1. First, the topic 1, Introduction to Anatomy of the Human Body. Anatomy and physiology are branches of science. Anatomy studies the structures of the body and the relationship among them. And physiology studies how the parts of the body works. The position of the body. First, we have the anatomical position. This position is the one that appears in the anatomy books. The person is standing facing the observer. The palms of the hands are extended to appreciate the anatomy. The feet are flat on the floor and are direct forward. When the body is in prone position, it means that it's laying face down. And when it's in supine position, it means that the person is lying face up. The human body can be divided into several main regions. The head contains the skull, which protects the brain, and the face, where the mouth, nose, and eyes are located. The neck is responsible for supporting the head and joining it with the trunk. In the trunk, we can find the chest, where the thoracic cavity is, which in a few moments I will talk about, and also the abdomen and the pelvis. Finally, there are the upper and lower limbs. The body planes are imaginary lines used to divide the body to visualize interior structure. In the sagittal plane, the body is divided into left and right sides by a vertical line. In the coronal plane, the body is divided into the anterior and posterior parts, and in the transverse plane, the body is divided into the inferior and the superior part. The human body is very complex. It has many parts, so to help to find an exact location, we use directional terms. If we imagine that the body is a map, the directional terms will be the instructions to find a place. Some of the most common are cephalic, which is close to the head, caudal, which is far from the head, anterior, which is in front of the body, posterior, which is at the back of the body, medial, which is close to the midline, and lateral if it's far from the midline. It's lateral if it's on the same side of the body as another structure, and if it's on the other side, it's called contralateral. Superficial or deep, depending on the depth at which the structure is located, and there are more directional terms that can be observed in the image. Body cavities are those spaces where the organs are located. We have several cavities in our body. For example, the cranial cavity is where the brain is located. In the thoracic cavity, we have the ribs, chest muscles, and the sternum. Within this cavity, there are smaller cavities that contains the heart and the lungs. The abdominopelvic cavity extends from below the diaphragm to the groin and contains many organs such as the stomach, intestines, liver, and even internal reproductive organs. And lastly, the vertebral cavity contains the spinal cord of the digestive, respiratory, urinary, and reproductive systems. They secrete mucus, which protects the body from bacterial and viral invasions. Serous membranes cover the organs in the thoracic and abdominal cavities, secreting a watery fluid that lubricates the membranes and reduces friction. Synovial membranes line the joints, allowing them to move smoothly within the joint cavity. The meninges serve as a protective covering for the brain and spinal cord. A feedback system is like a checkup. Our body monitors and evaluates itself. This system consists of three parts. The first is the receptor, which is a structure like a nerve that sends signals to the control center, usually the brain. And the brain then sends an impulse to the effector, which is responsible for producing a response that changes the controlled condition. Homeostasis is the condition of balancing the body's internal environment, produced by the interaction of all the body's regulatory processes. When this balance is disrupted, that's when we get sick. And now I will explain the second topic, body tissues. Cells that are similar join and start working for a specific function. This is called tissue. Connective tissue is one of the most abundant in the body and has several functions. It supports and fortifies other tissues, protects internal organs, transports substances such as blood, stores energy, and is a source of immune responses. And it's highly vascularized. Epithelial tissue is composed of compact cells that form a continuous layer and have varied functions depending on their location. And they serve as transport of substances, absorption of nutrients, protection, filtration, secretion, and excretion. Epithelial tissue has its own nerve supply, but is avascular. Muscle tissue is made up of elongated cells that called muscle fibers, which use ATP to generate force. These tissues are in charge of body movements. Other functions are to maintain posture, generate heat, and provide protection. There are three types of muscle tissues. The smooth muscle, they are present in many organs such as blood vessels, lungs, stomach, and intestines, and their movements are involuntary control. The cardiac muscle tissue, as its name says, is found in the walls of the heart, and like the smooth muscles, its movement is of involuntary control. Finally, there are the skeletal muscles, are the ones we use when we walk, run, ride, etc. And the movements are of voluntary control. Finally, the nervous tissues. There are two types of cells, the neuron and the neuroglia. The neuron is responsible for receiving and transmitting information within the brain, while the neuroglia provides support and maintenance so that neurons can function properly. Now, topic 3, integumentary system. The skin is the largest organ of the body and has many functions such as thermoregulation, blood storage, protection, synthesis of vitamin D, cutaneous sensations, excretion, and absorption. The most superficial layer is the epidermis, consisting of epithelial tissues and contains four main cell types: keratinocytes, melanocytes, Langerhans cells, and Merkel cells. It's avascular as it has no blood vessels, and below the epidermis is the dermis. This layer contains collagen and elastic fibers, which give the skin strength and extensibility. It contains blood vessels that nourish the skin and sensory receptors that respond to stimuli, and below the dermis is the last layer of the skin, which is called subcutaneous tissue. The skin has accessory organs such as hair. The hair follicle is in the dermis. There are also sebaceous and sudorific glands and nails. Skin cancer is the abnormal growth of skin cells occurring due to uncontrolled growth of skin cells due to alteration of their DNA. There are several risk factors for which a person can suffer skin cancer, such as having fair skin, excessive sun exposition, family history, etc. There are three types of skin cancer. The first is basal cell carcinoma, which represents 78% of the causes and rarely metastasize. Squamous cell carcinoma represents 20%. It affects the squamous cells and has a variable tendency to metastasize. And finally, the melanoma represents 2% of the causes, but is the most dangerous because it easily extends. These types of cancer are treatable, and its treatment depends on the type and size of the cancer. Some treatments are freezing the tumor with liquid nitrogen, surgery to remove the cancerous tissue, radiotherapy to eliminate cancerous cells, and chemotherapy where drugs are used to interrupt the cell cycle. Although it affects other cells of the body, such as hair cells. The topic 4 is the skeletal muscular system. The bones of the skeletal system constitute about 18% of body weight and serve several essential functions, including support, protection, assisting with movement, mineral homeostasis, blood cell production, and triglyceride storage. An adult has 206 bones, and they can be classified in several ways. One of them is the axial skeleton and the appendicular skeleton. The axial skeleton includes the bones of the skull, spine, ribs, and the sternum, while the appendicular skeleton includes the bone of the limbs and their girdles. The structure of the long bones are the diaphysis, which is the body of the bone, the epiphysis, which are the ends of the bones, the metaphysis, which is the union between the epiphysis and the diaphysis, The articular cartilage, which is on the surface where a joint is, the periosteum, which is the membrane that covers the bone, the medullary cavity, which contains the marrow, and the endosteum, which is the membrane that covers the medullary cavity. The four bone cells are osteogenic cells, which are the stem cells that generate osteoblasts, that are responsible of producing collagen and other components. Osteocytes are the mature cells that maintain bone metabolism, and osteoclasts are the cells that degrade the bone for its remodeling and release of minerals. The bones can also be classified according to their shape and size. The long bones, as its name indicates, are long and its main function is the support. An example is the femur. The short bones are the small bones that give stability, for example, the bones of the carpus. The flat bones have as main function the protection of organs, as for example the bones of the skull. The irregular bones don't have characteristics that allow them to be classified in other categories, and an example are the vertebrae. And an example of round bones is the patella. Topic 5 is exercise and its benefits to health. Aerobic exercise is also known as cardiovascular exercise. They are activities that improve oxygen consumption in the body, are performed at moderate intensity and for prolonged periods. Its benefits are to improve breathing, strengthen the heart, helps weight loss, prevent diseases such as diabetes and osteoporosis, and increases your endurance. Some examples are running at a moderate pace or playing tennis. On the other hand, anaerobic exercise focuses on increasing power and muscle mass and is effective in short duration and high intensity activities. Its benefits are strengthening bones, tendons, and ligaments. And an example is weightlifting. Flexibility exercise improves the range of motion of muscles and joints. Osteoporosis is a disease in which bones become fragile due to loss of bone density. Risk factors include age, gender, race, family history, and body size. Some controllable factors that also influence are hormonal levels, diet, and lifestyle.